One day at the Dr. Pseudomonas New Age Pool Hospital.
Oh man, we got another one from the pile-up.
This is Kamal. He has been in a very unfortunate accident recently and has been taken to this very strange medical center. Little would he know that soon he would have a run-in with the bacteria Pseudomonas.
Hey, Dr. Schmo. Right now it's time to intubate, so let's see. I have to go ahead and insert this in here. There we go. Perfectly fine. My job is done.
Despite this medical malpractice, Kamal would surprisingly recover from his injuries, and within a few days he was able to be released from the hospital. He then wanted to celebrate his recovery by taking a dip in the hospital's famous pool. However, a few hours beforehand...
Hey, do you know where we have any spare chlorine tablets? We seem to be all out.
Oh, who cares? It looks clean enough. We don't need any chlorine in here.
Okay.
2 hours later.
Free at last! Oh shit, I can't see. My contact.
It's all good.
Oh, I think I'm gonna like this place.
Warm water in my beard. It's the best feeling ever.
While Kamal has been inoculated with Pseudomonas aeruginosa, he still has a pretty good chance of staying as fit as a fiddle. Pseudomonas is an opportunistic pathogen, so he should stay healthy as long as he doesn't do anything to compromise his immune system.
Whee! Oh, hey, did you just get here? Yeah, I just arrived through the bloodstream, and guess what? I didn't see any white blood cells on the way down here. Well, I guess there's only one thing to do then. Party! Woo! Yeah! Alright! Woo! Woo! Let's party! Woo! Yeah! Alright! Woo! Woo! I haven't partied this hard since I was in that crazy mud puddle. Good times, good times.
Hello. Oh, dude. What's going on with you, bro? Dude, I don't know. My beard's been itching like crazy, and my ear's itching so bad it hurts. Painful. My eye itches too. Is it red?
Oh, yeah, it definitely is. Bro, we need to get you to a doctor.
Can't even breathe.
Yeah, we need to get you to a doctor like yesterday.
Hey doc, my beard's been so itchy and my eye, it's red. Do you see it? It's painful. Oh my god. And can't breathe and my ear is just full red and blown and hurts. Fix me, doctor.
Well, you're kind of warm. I think you have like
Is it
a flu. Yeah. Let me just give you some goods. Remember to take everything. So and just rest up and you'll be good. You'll be good.
Sure, doctor?
Yeah.
What about my itchy beard? It's never been like this.
It'll go away with time.
Okay.
Time cures all.
Thanks, doctor.
While Dr. Monas should have double-checked the bottle to make sure it was an antibiotic she was handing Kamal, it surprisingly still would not have helped that much. She was planning on only prescribing him the antibiotic cephalosporin. As it turns out, prescribing only one antibiotic is a very bad idea, as Pseudomonas has been known to develop multiple drug resistances in a hospital environment. The lone antibiotic might take out the majority of the bacteria initially, but individuals with additional protection will survive and multiply.
Troops ready? Ready!
Being a nosocomial disease means that Pseudomonas has done this many times and has developed advanced defenses to many antibiotics.
Dude, we gonna own this town.
Hey, how'd the doctor's visit go? Not good, dude. But it's just been getting worse. My other eye is red now, and my other ear also. I've just been taking these goods that Dr. P. Monas prescribed.
Allergy relief. Bro, I do not think you have allergies. I know I may not be a doctor, but I think you might want to go and get a second opinion on that.
Really? I heard Dr. P. Monas is really good though, but I'll go into a different doctor to get a second opinion now.
Yeah, that's probably for the best.
Doctor, what's wrong with me?
Yeah, Kamal, I see on your chart that you had a fever, an itchy beard, red, itchy, painful ears, and eye, a cough, trouble breathing. You really seem to have a lot going on. So I'm going to take some culture, since it doesn't seem to be getting better on its own, to see what kind of bacteria is growing. Yeah, so first we're going to take a blood sample. All right. And let's take some samples from your eye, your ear, beard. Okay. So we'll get that result back to you next week. Make sure to come in.
Alright, thanks, doctor.
Mm-hmm.
Lab technicians can check for the presence of Pseudomonas by using a Pseudomonas isolation auger. They can also check the morphology of Pseudomonas by gram staining, as seen here. When put under the microscope, you can see that Pseudomonas has a distinctive gram-negative rod shape.
What did you find?
Yeah, so all your cultures came back positive for Pseudomonas aeruginosa when I cultured them. So you have swimmer's ear, hot tub folliculitis in your beard, an eye infection, pneumonia, bacteremia from shooting up in a pool. Yeah, so basically we're going to treat with combination IV antibiotics and topical antibiotics for your skin infections. Yeah, you're a pretty sick dude. So, here's all your drugs. Make sure to take all of them so we don't get more resistance, since you already had some drug resistance from the hospital.
Okay, thanks, doctor.
Yeah, no problem.
I'll just take one right now.
Okay. Wait, why are you putting it in? No, you take these orally. No, don't shoot up.
No?
No.
Oh.
Just swallow it.
Oh, okay.
Yeah.
Hey, buddy? Yeah? I think we're toast. Yeah.
To recap, Pseudomonas is a gram-negative flagellated motile rod. Most species are fermentative obligate aerobes, though the species P. aeruginosa is a facultative anaerobe. This particular species is responsible for many of the sicknesses caused by Pseudomonas. In addition, Pseudomonas can form biofilms and is known to give spoiling food its fruity smell. Pseudomonas is ubiquitous, meaning it is found just about anywhere. It favors most moist locations, including on plant seeds, in swimming pools, hot tubs, and even in hospital sinks. Pseudomonas is not normally dangerous to healthy individuals. Its most common victims are people who are immunocompromised. For this reason, it is mainly a nosocomial disease. Pseudomonas can settle in multiple parts of the body. Most notably, P. aeruginosa is capable of infecting the lungs, while other species can infect skin and burn victims, cause urinary tract infections, and can occasionally cause surface infections in healthy individuals. Its virulence factors include exotoxin A, which inactivates eukaryotic elongation factor, similar to diphtheria toxin, and XOU, which degrades the plasma membrane. In addition, Pseudomonas possesses a capsule that protects it from phagocytosis. Symptoms include blue-green necrosis in wounds or on nails, septic shock in immune-compromised individuals, and fever and lung abscesses are typical in hospital cases. In addition to the features mentioned earlier, Pseudomonas can be identified as oxidase positive, and it can be isolated using Pseudomonas isolation agar. The best way to prevent this disease is to limit exposure to contaminated environments. This includes avoiding contamination of contact lenses or contamination of contact fluid, staying away from poorly maintained pools and hot tubs, and remembering to wash your hands frequently. Traditionally, the best way to treat Pseudomonas is with combination therapy using antibiotics such as carbapenem, monobactam, and cephalosporin in combination with beta-lactam. However, recent studies have shown that single drug therapy with just beta-lactam can be effective as well. Now, Kamal was treated with combination therapy, so let's see how he turned out.
It was tempting, it would have been the easy way out, but we managed to make an entire Pseudomonas video without making a pseudo joke.
Pseudo.
Oh, for Pete's sake.